well, we're delighted to be here today to share with you our early presentation of cancer symptoms programme in North East Lincolnshire, which has been running now for 4 years. And this was set against a backdrop really of health inequalities and higher than cancer average mortality. However, I think what was missing for us was the front end of the pathway, and that was cancer awareness was lacking across the whole health and wellbeing community, not just in communities themselves, but also in the wider public health domain. So we were really clear we wanted some kind of transformational programme that would look at doing things differently, and that's what I hope to explain to you today. The theory behind it sits in 3 well-known frameworks really, that of community development, so that's engaging communities as change agents, which has really been key to this programme, and social marketing, looking at where people are, what they understand and how they can change behaviour. And the collaborative methodology, which I'm sure will be well known to you, the planning, the testing, the studying and acting on theories. The improvement model that we use looks like this. Essentially, we engage with key stakeholders, and it's a flexible framework through which we push and pull communities based on learning what works, trying and testing it out, and then adapting it. But I suppose this really is easier to understand if you see it in action, and we're now just going to show you a short video clip.
Oh, why not?
The early presentation of cancer symptoms programme brings together services and local people in community action teams to tackle inequalities and build stronger communities. It's a brand new community-led social marketing approach to support earlier presentation of cancer symptoms. We share what works at learning events and combine it with local knowledge and local insight back in communities. New resources are developed and tested to resonate with target audiences. The range of activity is phenomenal, and there is a deliberate focus on joining up with services and supporting a move from greater awareness into action. Different mediums, networks and partnerships are used to engage people.
I think to try and sum up the programme, what I would say is that people have not been the problem. In fact, they've been part of the solution to raising the awareness of cancer symptoms within North East Lincolnshire. I have to say, I think they've achieved so much in such a short space of time.
But I guess what you would be interested in really is about the patient outcomes and patient experiences that we have discovered. Well, we've certainly, we feel, made an impact on early presentation. Our suspected cancer referral rates, the 2-week waits, have increased even after 1 year by these percentages that you see, and these have been sustained over 4 years now. Also, when we did a national cancer awareness measure and measured ourselves against that locally, we had nearly double the national average of awareness on bowel screening. So I think we can claim that we have made an impact for patients, and we've certainly managed to introduce better services. For instance, we've brought in an outreach health trainer service to support young women to go forward for cervical screening where they might not normally have done so. And we have numerous case studies of patients saying that they feel empowered to present earlier. We were asked to demonstrate value for money, and of course it's always very difficult with a community-led initiative, but we had a piece of work done for us with our recent lung project that showed us something about the social return on investment for using volunteers as key change agents. And this was what they came up with for us, and it just assumed a modest impact on end-of-life care by 10%, but actually coming out altogether at a 34.6% return on investment. However, I think this programme also brings additionality. We can see and do a rapid change, and that's really important to the volunteers that they see that. It's very scalable, but it brings many organisational extras too in terms of quality standards that we need to meet. But I think we're building new skills and capacity for the future, and I think we could claim it's the big society in action. Another thing I think which is fairly unique about this programme is that I think we've really created a culture change for cancer. One of the biggest inhibitors we have, local people have, is the fear of cancer. And by talking about it and raising awareness in our local community, people now more readily talk about it in North East Lincolnshire. There is the potential to save many lives. Actually that's a typo, I've just discovered it should be 5,000 lives per year by early presentation, and apologies for that. But I do believe we're impacting on mortality and that we've improved the service and community interface between ourselves and communities. We are regularly asked to share what works. Up to present, about 20 inquiries from other PCTs. We have written it up in the British Journal of Public Health, and there's another paper in production. It's a best case model on the National Social Marketing website. But locally, in our business cases, we've adopted the same model to spread into other topics such as coronary heart disease and tissue viability. And more recently, we've developed a Cancer Champions training package. The timescales for us were over a 12-month period, but the point to make is that this is adaptable and that we can build it into our regular planning cycles. The spread and sustainability via the recently introduced Cancer Champions training package is also important. This is a shorter package with the aim of getting a cancer champion in every network across our society, because I believe that only by doing that will we really reduce the fear of cancer. We've developed a basket of measures jointly with clinical staff and community staff, and you'll see them listed in the green box, and we don't have time to discuss them all here today. But the important thing is that we review them regularly in monthly meetings with the communities themselves, and this drives the change improvement for them. They're constantly looking at things. We did our own pre and post measurement questionnaire before the cancer awareness measure was introduced, and we were seeing a 15% increase in people's willingness to talk about cancer. So I think that's significant. We've really done well with local media. We average 4 media insertions a month, and more recently we've delved into social media, Facebook, etc. So, as a summary, what's our uniqueness, do you think? Well, I think it is about changing the culture for cancer. It's about recruiting people as passports into the local community, spreading the word that there is hope about cancer if we get early presentation and detection. We've proved that we can sustain the impact. We've now been running for 4 years. We have 53 volunteers. We have 50 cancer champions in training and another 50 waiting. And I believe we're value for money because we have thousands of hours worth of volunteer work that spreads this word out into the community. And if we only move one person to early presentation, the potential is to save in the region of £75,000. Thank you.